my name is Matthew Gilbranson. I've been a licensed acupuncturist for about 4 years now, and for that entire time I've worked for the Working Class Acupuncture Clinic. I also had my own, what we call private practice, for about a year in Portland. So let's see. Basically, I want to talk just a little bit about what acupuncture is, how it works somewhat. And acupuncture really is just placing, very fine steel needles into the skin to stimulate points. The idea is that there's a circulation of energy in the body, and just like the blood flow in the body, it follows these pathways that we call meridians. And points are specific points within the meridian where energy tends to pool or collect or sometimes get stuck. And really the idea is that by placing the needles in, we facilitate movement. That movement creates circulation. It opens up those blockages. Pain is relieved, tension relaxes, stuff like that. Acupuncture is widely useful for a variety of problems. Just about everything will respond in some way. Certain things will respond more, certain things less, and it's dependent on the patient as well. Some people really have miraculous kind of responses. Other people get limited sort of benefit. I'd say probably 70–80% of the time you will see benefit with treatment. And then it's just sort of a range from a complete cure to it really didn't do anything. But the vast majority of folks do see good benefit. One of the reasons for this is most illness has stress as a major component. If stress isn't the root of the problem, it often is a huge factor in the problem. Classic examples like stomach ache. An ulcer is a really obvious sort of example where there's a physical problem. Stress magnifies it several times over. Same thing can happen with high blood pressure, even back pain. There's always emotional components to any sort of illness, any sort of distress. So acupuncture is one of the things that's really good at treating stress. A lot of Western medicine, or what we call biomedicine, isn't particularly effective for stress. You can take drugs, that's about it. Other things you can do, major lifestyle changes, drop out of school, quit your job, move away from your family. Those aren't really logistically possible for most people. Acupuncture is a great way to get stress management in a sort of way that fits into your life. The other thing about stress is it's usually constant. Almost everybody has it in their lives. It's almost always this pressure that's sort of always there. And with the acupuncture, it's really important for consistency of treatment. You're not really going to see miraculous changes after just a few treatments. It's much closer to a yoga class or going to the gym, right? You wouldn't just go to the gym, do 2 or 3 workouts and be like, all right, I'm all buff now, I'm all flexible. It just doesn't work. You're under constant stress all the time. You need to ameliorate that on a consistent basis. This is how acupuncture has been done in China for thousands of years, how it continues to be done in China. It's not unusual for somebody to get daily, every other day treatment for weeks sometimes, and sometimes more. Acupuncture, when it became adopted in America, there's this real push to make it sort of mainstream. So the model that was adopted was a medical doctor model. And so a lot of the practitioners took on this idea of having a small exam room, just you and the doctor, a lab coat, that all of this sort of trappings of medicine. Lots of education. The upshot of all of this is it's very expensive to become a practitioner of acupuncture, and therefore a lot of acupuncturists feel pressure to charge a lot for their services, just like a doctor. I would say the going rate for acupuncture in Portland metro area is in between $60 and $90 a treatment. Typically you'll have a $30, $50 first time treatment charge. Most practitioners spend a good chunk of extra time with you at the very first, and paperwork and all that sort of stuff. So if you don't have insurance, that's not very affordable. Even if you do have insurance, most insurance plans set really strict limits on the amount of acupuncture you can get, say in a week or a month or in a year, 15 treatments in a year, stuff like that. So if you're having to pay out of pocket, $60 to $90 a week becomes really expensive. For most patients, I recommend an initial course of treatment of about 4 to 6 treatments. That's a good period of time for you to evaluate whether you're going to see the kind of progress that you want with the treatment or not. If you're paying those rates, you're paying about $400 for that 6 weeks. And I saw this in my private practice too, even though my rates were considerably cheaper. I think I charged $45 per treatment. That people would come in for as much as they could afford. They'd see really good benefits, and then they'd kind of run out of money, so they'd stop coming, and then they would sort of have to wait until they had enough to pay my fees again to come back in. All the while their pain is slowly kind of coming back. It's usually the sort of thing where you're at this sort of pain level, a good course of treatment brings you all the way down here, and then it kind of creeps back. Again, with that whole stress thing, all the stresses in your life are probably still there. People tend to have weaknesses, like their back or their knees or their arthritis or emotional weaknesses, and all that stress throughout our lives creates, creates this sort of symptomology that tends to just sort of come back. Now, if you can afford to, it's great. You come back once a week, every once in a while. If you're really stressed out, or let's say you pull your back or something, you just come in for a while. But really what we want to see is consistency over time to really sort of maintain the gains that people have seen, and also so it just doesn't backslide. So with people having trouble affording regular, consistent, frequent treatment, Working Class Acupuncture was founded to solve this problem by Lisa Roletter. That was about 8 years ago. The clinic was called Window of the Sky at the time, and then about 2 or 3 years later it became Working Class Acupuncture. That's when I was hired. Basically, we charge a completely voluntary sliding scale. Now, the low end of that scale is $15 per treatment. The high end is $35. Everybody pays whatever they feel they can afford between there. We don't keep track. It doesn't matter to us what people pay. A lot of my patients will pay $15 when they're running low on cash, and then maybe they'll pay $20, when they're feeling good or they just got their paycheck or something. They're running low on cash again, $15, doesn't matter. Other people, all they can afford is $15 per treatment. That's all they pay, and that's fine by us. We're there to facilitate that kind of health care. We do charge a little extra for the first visit. It's $10. So the first visit will be $25, and then subsequent visits $15. So a lot of people find that's affordable, that's actually sustainable. So to take that earlier example, if you're paying $60 a treatment, you get 6 treatments for $400. If you come to Working Class Acupuncture for $400, you get about 6 months worth of weekly treatments. Just doing the math there, you can see how much more effect you're going to get from 6 months of weekly treatment.